Yeah, my name's Professor Stuart Brierley. I'm Director of the Visceral Pain Research Group, Director of the Hopwood Centre for Neurobiology, and co-leader of the Lifelong Health theme at the South Australian Health and Medical Research Institute in Adelaide, Australia. I was born in London, did my PhD at the University of Adelaide, been working as a researcher now for 24 years. Been fortunate enough to be working at SAHMRI for the last 10 years. We were here when the building opened, and we'd like to think we've made some pretty significant strides in understanding how pain happens from the gastrointestinal tract or the gut. My area of research focuses on pain. It's a massive clinical issue globally. We've also obviously seen that there's the global pandemic with the opioid crisis, and that gives us an indication as to how bad the issue is. But the problem is that there is a complete lack of treatments for pain, particularly those originating from the gastrointestinal tract. So my research is focusing on understanding how pain is generated from the gastrointestinal tract in diseases such as irritable bowel syndrome, inflammatory bowel disease, and endometriosis, finding how this pain happens in these conditions and finding new novel therapeutic treatments so we can get some pain relief for these patients who have been suffering in many cases for decades with these conditions. My group has been focusing on the gut-brain axis and how our gut communicates with our brain for the last 24 years. We've made a lot of novel discoveries, discovering how single individual cells within the gastrointestinal tract communicate via nerves to the brain to signal pain, and also how it triggers symptoms such as depression and anxiety. We've been fortunate enough to work with collaborators throughout Australia and also internationally. That includes collaborators most notably at the University of California, San Francisco, looking at how a particular cell type called the enterochromaffin cell helps signal pain and anxiety from the gastrointestinal tract. And those labs include that of Dr. Jim Bayer, Professor Holly Ingram, Professor David Julius, who was the 2021 Nobel Prize winner in physiology. For me, it's all about helping people. As I mentioned, we've got a global issue in terms of pain. Pain's a debilitating condition, not only for the individual suffering from it, but also for their family. It's an insidious condition, and one of the reasons for that is because there is a lack of therapeutic treatments. Our work is trying to understand how this pain is caused in these diseases, and therefore if we can find out what the causes are, we can make very specific targeted approaches to treat this pain. And we've already been successful in doing that so far. So it's a pretty busy job, this one, but I've got two young daughters who keep me pretty occupied the rest of the time. Lots of interests. Used to be pretty good at soccer or football a long time ago in a galaxy far, far away. But otherwise, sport, music, food, etc.